Sorry.
All righty. So if you don't mind, if a couple of people would like to share to introduce yourself and your role, and you can just answer, any of these questions. Who is the population that you serve? Obviously, you all work at Texas Children's Hospital. Oh my. I'm sorry, give me 1 second. I thought I plugged my laptop. I'm very sorry. Sorry about that. I'll be right back. I'm so sorry.
I'm gonna get a color. Great.
I'm back. Sorry about that. All righty, we're good to go. Okay. Would anyone like to introduce themselves so we can just get a feel for who's in the room?
Volunteers.
Any volunteers?
No. Finish yourself. Gary.
Your role, social worker for cardiology. What else?
And who was that just spoke? What's your name?
That little thing right there is the mic. Oh, okay. Yeah. Okay. Were you able to hear?
I only heard that she's a social worker on the cardiology floor.
Yeah. Rhonda Howard.
Okay, hi Rhonda, welcome. Would anyone else like to share? And we have a question here. If you would like to answer this question about, have you observed anything different or unique with the population that you work with? Get you to think a little bit. Anything different, anything unique, anything that stands out to you, anything that you need to, kind of think through, like, something special, something that I need to be aware of. Anyone else want to introduce themselves or their role? And maybe answer that question.
Come towards this way because the mic is over here.
Okay. Is this the mic?
Yeah.
Hi, good morning.
Good
My name is
morning.
My My name is Jocelyn Hutron, and I work with outpatient clinics. So I cover 4 clinics now: plastic surgery, orthodontics, speech, and dental. Been covering them for almost 2 years. And something interesting in this past 2 years I've seen specifically with like cleft lip and palate kiddos and plastic surgery is that a lot of them have shared with me, insecurities about their facial difference, but also that connection with the pandemic and mask wearing, that was actually something good for them. Because the
like
cleft lip-
a protective shield almost.
Yes, ma'am. And also just like doing school from home. A lot of times, like my kiddos get bullied, isolated because their medical condition is so present and just showing, right? So they wear it every day. And so it's been kind of interesting to learn and like walk with them through this journey because their cleft lip timeline, they get like their initial cleft lip repair about like 6 months of age, 3 months of age, but then they have like the scar that stays with them through life. And so it's been really interesting and I hope to like learn more about it.
That's very interesting. Thank you, Jocelyn. Can we hear from 2 more social workers and answer that question about anything you observed with the patient population that you work with or the families that you work with that's different or unique? Go ahead. Hi.
Hi, my name is Maricela. I am a cancer center social worker, specifically the bone marrow transplant unit. The population I serve is babies to adults who are receiving a bone marrow transplant. What is different or unique about the population? I mean, it's such a wide question that I wish it was more specific. So, I mean, I think what I've observed is these families are so resilient, and sometimes they get discouraged. And I think it's a gift to provide them the support to remind them of how resilient they are and what resources they already have. And also just that there are quite a few resources for financial assistance. I think that's very unique for the population I serve.
Thank you for sharing, Maricela. And from one more, please, just for the sake of time.
I think that would be a unique perspective.
My limited role. You can see me now?
I can't see you, but I can hear you.
Okay,
What's your
well,
name?
Alicia Booker. I am retired military, and this is my second job as a social worker, and I'm in ED. So my unique and limited experience is when you're in the ED, there is so many different nationalities as well as languages that you have to be able to use interpreter. And then a lot of times there is a disconnect in the services. So with that said, I can see that barrier, but at the same time, it's a small one and it can be rectified. So that's, I'm the last person and I just give you that perspective.
Thank you. When you say ED, what does that stand for?
Okay.
Emergency room.
The emergency department.
Oh, EC, Emergency Center, or, okay.
Yes.
I thought she said ED. Okay, EC,
We
okay.
did, but that's
Oh, okay.
the emergency department or.
Oh,
emergency-
department. Okay, got it. Okay, perfect. Thank you so much to all of you for sharing. And we're gonna talk more a little bit about that. But the reason why I like to start off with doing some introductions and hearing about what's unique about the population that you work with or what's different. And it is a very broad question, and it's intended to be broad so that you can really decide how you want to focus in or on that. But I think as social workers who work in various medical specialties, you can really establish this tunnel vision and kind of focus in on your work, your task, your patients, your families, without really having much time to connect with other social workers that may work down the hall from you, that may work in a different building from you. Maybe the building is walking distance, maybe it's not, maybe you need to take a shuttle, I don't know. But it's important as we do this work as social workers to connect with one another and to hear what other social workers are experiencing, what they're seeing, and to provide that support to one another as we hear those stories from one another. So today, what I really want to ask from you, I'm going to ask the second question about how you're feeling. If I was in front of you, physically in front of you, not virtually, right? My intention would be to really create a safe space for all of us to share and to connect. Because I don't think as social workers, we often have that opportunity to create those safe spaces for each other, to be able to connect, to be able to share, to be able to support one another, and to be able to empower one another to do this really heavy and arduous work. So I'm going to ask that we all try to be intentional about putting something from ourselves to creating a safe space in this small amount of time that we have. Are y'all with me?
I'm with you.
Okay, wonderful. And I also want to say this, it's really important that in a safe space that whatever we share, that, we just keep it in the room and we just honor the space that we're creating today. Okay, so we're creating a safe space. We're going to do some, review some terms, some definitions, review some things that you may have heard of, and also, learn from one another during this session today. So how are you feeling today? Would anyone like to, you can shout out, you can say it out loud, you can pick 2 or 3 words to describe your emotions.
I'm feeling free, grateful, and peaceful.
Free, grateful, and peaceful. I love that. Thank you for sharing. Who else would like to share? I can go ahead and share while y'all are kind of trying to gather what your feelings are. I am feeling connected with you all this morning. I'm feeling intentional. I'm feeling a little bit anxious because it's like, it's a presentation. You want to do well. You want to be able to, connect with social workers and provide support. So those are the feelings that I'm feeling today. Anyone else like to share? Okay.
I'll share. I'm feeling anxious, happy, and great.
Okay. Thank you for sharing. Anxious, happy, and great. All righty. Well, thank you so much for sharing, social workers. So we're going to talk more about, what it means to, create these safe spaces within ourselves and also for caregivers. Doing these activities, I think, is really important because it really does shed a light on the fact that caregivers of patients that you serve have, various emotions that they experience on a day-to-day. And I know that a big part of your work as social workers is providing that emotional support. And I'm sure that most of you are very, very, skilled at that, at providing that emotional support, at being present and practicing compassion with patients and families. But this is just a way for us to get into the practice of feeling comfortable with expressing ourselves, with creating those safe spaces so that we can share our emotions and our feelings as well. And we're gonna talk more about that as we go on. Okay, so thank you all for volunteering, being good sports. All right, so we're going to talk a little bit about managing stress and building resilience. I know that y'all have heard these terms many, many times in your careers, but it's just important to really continue to facilitate these conversations and these discussions, and to have these ongoing reminders present about managing stress and building resilience. So when we talk about managing stress, it's important to recognize that our ability to manage stress is actually a part of what builds resilience. And we know that as the ability to bounce back, after experiencing challenges, pressure, or even disappointment. And you may experience that in your personal life. You may experience that at work. And you may observe caregivers of patients and families experiencing that. Maybe they hoped for better news from the medical provider. Maybe the surgery or the procedure didn't go well. Maybe they applied for a resource and the waiting list is too long. There are various reasons that contribute to stress. And so that's why talking about managing stress and how that builds resilience is so important. How many of you have seen caregivers or patients receive some disappointing news or experience a challenge, and you still see them get back up and try again? They come to the hospital again. You can kind of raise your hands. They keep going at it. They don't stop. They don't let it defeat them. Even though sometimes they may even feel defeated, they still continue to fight, right? That is resilience. That is that grit and that resilience that we're talking about. Going on to practicing mindfulness, that can promote self-care and well-being, and increase resilience to stress, the quality of your professional life, and your self-compassion. So this is more about, not just continuing to work in silos, but coming out of that, connecting with each other, supporting each other, and being very intentional about practicing that mindfulness. That can be done on your lunch break. That can be done before work, after work. That can be done in your personal time at home on the weekends. You can decide to be very intentional about practicing mindfulness. You can even ask yourself, are there things that I used to do that was a part of my mindfulness strategies that I stopped doing? Maybe you stopped doing it because it got too hard to do because of the pandemic or the aftermath of the pandemic, or maybe work got really, really busy and you stopped doing those mindfulness strategies. Sometimes it's the things that we're not doing that impact us the most. So I just want to encourage you to continue to just take a look at what those mindfulness strategies are that work for you, that can promote your self-care. And we're going to go back and forth about talking about things that will support you as social workers, and also what you can do to support the caregivers and the patients that you serve. But we can't forget about ourselves. We have to remember ourselves, and that our needs are very, very important, and that our feelings and emotions are also valid. Okay. Then here, we have practicing self-compassion helps to manage stress. So as social workers, we're not perfect. We don't always have all the answers, right? And we have some rough days, we have some difficult days. But in those moments where there's struggle, where there's rough days, where there's difficult days, where maybe you even made a mistake, are you practicing self-compassion, or are you being hypercritical of yourself, or are you punishing yourself? Are you practicing shame and guilt and all of that? Or are you giving yourself grace, right? These are these self-inventories that we need to continue to have with ourselves to ensure that we're continuing to practice that self-compassion. And that self-compassion that we speak of is associated with resilience, happiness, optimism, and with doing the work, courage, and that increased emotional intelligence. Okay, y'all with me? How are we doing? Deirdre, can you please remind me, I have till 10 or 9:50?
9:50.
Uh-oh. Okay. That's quick.
9:55.
9:55. Okay, thank you. All right. So going on to resilience, that process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. And so many of you have, time and time again seen that resilience in the patients and the families that you serve, right? That mental toughness to push past the hard situations, the challenges, to overcome doubt, fear, and worry, and remain positive. But as we encourage resilience, as we foster resilience for patients and families, we have to remember, what does resilience look like and feel like in ourselves, right? How do we as social workers overcome doubt and fear and worry in the workplace? How do we remain positive in our roles on the great days and also on the hard days, on the not so great days? So these are just things to continue to think through, to sort through, and to really just practice that self-inventory and that self-reflection. And another important thing about resilience that I want to mention is learning to adapt to things that might not change. And I'm sure that many of you have experienced that or have witnessed that. And I'm sure that many of you have even like thought about, oh, this isn't going to change. This isn't going the way that I planned. Now, how do I adapt? How do I keep moving forward? And that's the resilience that I'm speaking of. So what can you do to promote resilience? We can be intentional about creating safe spaces for caregivers, for patients, for communities, and ourselves. And you determine what that community is for you. Maybe your community is your coworkers. Maybe your community is your friends, your families, other organizations that you're a part of. Maybe it's your community is, your religious organizations or your spiritual life. You can determine what community means for you, and being intentional about creating those safe spaces helps to promote resilience. So why is creating a safe space important? Creating a safe space for caregivers to share lived experience. Lived experience fosters resilience building. And I can guess that many of you do this already. When you check in with your patients, whether it's in person, whether you see them at their appointment, before their procedure or after their procedure, or over a phone call, or even if, the doctor puts in an order for social work and you go and check in with them and provide them emotional support, or connect them to resources. Many of you are bridge connectors to resources to support families. That's all creating a safe space, and that fosters resilience building. Creating a safe space for caregivers to share their stressors can provide a sense of support and minimize feelings of isolation. And creating a safe space for caregivers can provide them with a sense of hope. How many of you believe that you are already practicing creating a safe space in your work? Can I see hands go up if you feel like you're doing this already? Yeah. And here are some coping strategies for caregivers to foster resilience. These are just a few strategies that I put together as you continue to provide support to caregivers and empower them in your day-to-day work, focusing on things that they can control, encouraging them to ask for help or support. And that could be, you know, them making a list of ways that other people can help them, whether it's their family members, whether it's their friends, their own community, creating routines and creating new habits, deep breathing or relaxation activities, mindfulness, practicing that mindfulness, counseling, therapy, or support groups, developing community connections, and utilizing internal beliefs or spirituality. That's a really, really important one, to really rely on what are those beliefs that you believe in. What are things that you believe in that get you through the day, that get you through difficult times? These are coping strategies that we can encourage caregivers to use, but we can also use these coping strategies for ourselves as social workers as well. Okay. And then the last one, I have those quick pick-me-ups, and I'm going to show you an example of that. So these are some quick pick-me-ups. They're just things that you could do really quickly to help yourself to feel better, to help manage stress, and to foster resilience. So these are just some things that you can encourage caregivers to do. There are also things that you can do for yourself as you create safe spaces within yourself or using your surroundings, areas that you have access to create those safe spaces as you continue to practice social work. So here are just a couple of them. I love this one. One of my favorite ones, say out loud, I can and I will. One of them I encourage people to say is, I can do hard things. Name something beautiful. Raise your hand above your head and say, woo. I mean, it just kind of depends on the vibe and the context and what's happening, right? But it just really depends. And I want to say, social workers, really think about that accountability piece with encouraging one another to use these quick pick-me-ups or to use the coping strategies to foster resilience, even in the workplace, because that can really, really help your workday go smoother, support that positive culture of supporting and empowering each other and staying connected and taking the time to take care of yourselves. So I want to encourage you all to encourage each other to do these things as well. So here are some of the components of creating a safe space. We know that as social workers, right, we always look to practice empathy, that awareness of another person's feelings, not sympathy, not pity, or putting yourself in that person's shoes, practicing that compassion, displaying kindness and that willingness to support and to understand the distress. And that compassion is towards yourself and also towards others, okay? I really do believe that when we practice that self-compassion, it makes it easier to extend that self-compassion to other people in our surroundings, whether it is people in your community or the population that you serve in your workplace. And then I encourage you all to continue to listen with empathy and provide a compassionate response, not just for your patients and families, but also to yourselves. What are those thoughts that you're thinking? What are those feelings that you're having? Provide yourself a compassionate response. Be easy with yourself as you do this work. So as we continue to talk about creating a safe space for caregivers, I have these 3 E's that I like to talk about, you know, establish, equip, and empower. When we create safe space for caregivers, we want to, of course, establish trust, that respect, that confidentiality, listening with empathy, sharing those personal stories as it relates to their current situation and lived experiences. We want to equip caregivers with tools to practice self-care, okay? And that can look very differently, whether it's, in the OP clinics, outpatient clinics, whether it's in the emergency department, whether it's, on the cardiology floor, or at the cancer center, excuse me, it can look very differently, right? So it's just really about, thinking through what's going to be most helpful for your caregivers on these different areas of the hospital that you work in, and empower caregivers to utilize their internal supports as well, right? What are the belief systems, the affirmations, what are the things or the people that they value or hold dear, to utilize that for support, okay? Okay, so I know we're running out of time, but we can use this as, just reflection that you can kind of think about those challenges that caregivers might be experiencing. You can share those challenges with each other. You can also share ways to provide safe spaces for caregivers of pediatric patients. So these are just ways to kind of think through what those challenges are and how to provide those safe spaces for caregivers to share. Okay. And also, as you do those reflections and as you continue to talk to each other, you can share a tool, a resource, or a strategy, and you can learn from each other. And you can take those things back to the patients and the families that you're serving. How are y'all doing? Y'all with me? You good?
Yeah.
Okay. Alrighty. So now we're gonna move into something that's really, really important. We're gonna talk a little bit about secondary trauma, or prolonged exposure to other people's trauma. So, people such as ourselves, social workers, whose professions lead to exposure to other people's trauma, can be vulnerable to experiencing compassion fatigue, or known as secondary trauma. And they can experience acute symptoms that put their physical and mental health at risk, making them feel very weary of giving and caring. So we just continue to have these conversations and encourage you to have these conversations in the safe spaces that you create, so that you are aware of the emotional duress or distress that you could be experiencing in your difficult roles. And when you're aware of it, that is the first step to figuring out what to do about it. So it's just something to continue to be aware of. Vicarious trauma or grief, that's the repeated exposure or the details of other people's trauma and grief stories. But vicarious trauma is more the slow moving toll of the indirect trauma exposure that can change your view of the world. So being mindful of the vicarious trauma, spending some time to, I think someone is trying to enter the meeting. I'm sorry, I don't know how to let this person in without disrupting the PowerPoint. I didn't know the Zoom was open to anyone. Or Deirdre, if you can help me with that, I'm not sure.
It's just the next presenter, sorry.
Oh, it's the next presenter. Okay. Go back to, so it's that slow moving toll, right? So taking the time as you create the safe spaces for yourself to check, how am I feeling? That's one of the reasons why I asked, what are those 3 feelings that feelings will? You can even start off by doing that. How am I feeling? What are the thoughts that I'm thinking? Am I feeling exhausted? Am I feeling overwhelmed? Is this work becoming really heavy for me? What resources are available for me to take care of myself? These are really important questions to ask yourself and to support one another with as you're doing this work. Okay. So we have some potential symptoms to look out for when experiencing secondary traumatic stress. Here are some symptoms that you could be experiencing or to be knowledgeable about, to look out for. And these are just a few of them listed here. Hopelessness, hypervigilance, avoidance of patients or families or clients, chronic exhaustion, fear, minimizing sleeplessness. These are just some of the potential symptoms of secondary traumatic stress, symptoms to look out for and to be aware of. We did talk a little bit about compassion fatigue. It's those normal displays of stress resulting from caregiving or physical, emotional, or spiritual exhaustion, okay? And some of you may have experienced compassion fatigue in your work. And it's important for us to have those honest conversations. Some of you may even be experiencing that right now. And so we'll talk more about how to the risk of the cost of caring and how to mitigate that, okay? And then we have burnout defined here, just feeling mentally or emotionally exhausted, the lack of satisfaction with your role, feeling overwhelmed, or a reaction to our work environment. So as we create these safe spaces, it's going to help to increase the awareness. And as we practice mindfulness, it'll help us increase our awareness of what is going on with us internally, what is going on with us mentally and physically, and what do we need to do? What are some strategies? What are some action steps? What can we do to be able to experience that vicarious resilience? And we're going to talk more about that. Okay, so this term cost of caring is coined by psychologist Charles Figley, and it's a way to describe this natural negative consequence of the work of helping professions. The cost of caring can be very, very heavy. And we see the cost of caring, it includes all of the terms that we define, that vicarious trauma or grief, burnout, compassion fatigue, or secondary traumatic stress. Then the cost of caring risk, there are cost of caring risk, but there are also resilience factors. So we can look at our personality and our coping style. We can take a look at our current life circumstances, spiritual resources, our work style, social supports, and lived experiences, past trauma or grief history, okay? So what are those things that really impact us? What are things that are ongoing that's impacting us? What are things in the past that has impacted us, okay? And how does that contribute to that cost of caring? Okay. This is a self-care inventory. We're not going to really spend time going into it, but it is a resource. And so if you would like this resource, use this as a resource, you'll be able to have access to it at the end, the references at the end of the presentation. So we've talked about compassion fatigue and burnout, secondary trauma, vicarious trauma, all of that. There is good news. There is something called compassion satisfaction, and that is really deriving pleasure or fulfillment from helping others. Many of us do this work because we are passionate about this work that we do, and we experience a sense of fulfillment from this work that we do. So this is a little bit of, cognitive reframing, or finding different ways to think about the work that we do, finding different ways to practice the gratitude. How many of you have heard just positive stories or positive outcomes from patients and families that you serve, either them sharing it with you or the doctors or the nurses. Raise a set of hands. How many of you have heard of those positive outcomes? Yeah, those positive outcomes, those positive stories, those great days that we have, all of that contributes to that compassion satisfaction. And it's very important to share those stories as well, to share those narratives with each other as well, because you can really support each other in doing this hard work, this arduous work, by sharing those stories of those positive patient outcomes, of that resource that went through, or whatever it is that really helped your patient and your families. We have that vicarious resilience, which is that positive transformation as a result of bearing witness to individuals overcoming adversities. And I'm sure many of you have seen patients and families overcome adversity after adversity after adversity. And that is what creates that vicarious resilience. I'm sure many of you have overcome challenges and adversity. You're not a social worker if you have not overcome a challenge. I mean, getting the master's degree alone, I would say, is adversity. So I'm sure all of you in there have had an experience where you have been able to overcome an adversity. So being able to really think back on that and reflect on that is so powerful with creating that compassion satisfaction and that vicarious resilience. And then there's self-care. It's like, oh, we keep talking about self-care. And it can be like, you could get tired of hearing the term self-care, but we keep, going on and on and on about it because it's so important. So caring for yourself can really help to reduce the cost of caring and increase that compassion satisfaction and that personal resiliency. So really being thoughtful about creating those safe spaces for yourself in your workplace and practicing that self-care even in your workplace, not just when you get off work. Okay, making sure you take your lunch, making sure you drink a lot of water, maybe even printing out some pictures and putting it on your computer screen, or getting some Sensies or some aromatherapy oils. Not light a candle. Can't light candles in a hospital. But what are some things that you can do to promote that self-care to increase the compassion satisfaction and the resiliency? Oh my gosh, y'all, I'm running out of time. But we have strategies for prevention to increase that compassion satisfaction. And as social workers, you've all done this clinical supervision, or maybe some of you are doing that now. Self-care groups, flex time scheduling, if your supervisor allows that. Having a self-care buddy or accountability buddy. What are those evidence-based practices? What is that psychoeducation? How does it look like to have a balanced caseload, or to have that supportive relationship with your professional relationship with your coworker or colleague to help support each other so that you can take time off? Looking at your PTO and saying, okay, can I use some of this PTO to take care of me? Like, what are those strategies that promote compassion satisfaction? And it's going to be different for all of you. So it's just taking time to practice that self-reflection, to figure out what works well for you. We have strategies for intervention. Okay. We have these strategies here. Some of them I just discussed. But these are just continued strategies that we can utilize in our day-to-day work. Before we go, I do want to talk about, I know I have one more minute. I want to talk about trauma stewardship. This is from the book from very amazing author and speaker, Laura Von Dern. Lipsky. And trauma stewardship refers to that conversation about how we come to do the work and how we are affected by it and how we make sense of it and learn from those experiences. It's a very important ongoing conversation that we have to continue to have, and an increased sense of awareness that we need to continue to have as we do this work as social workers. So I just wanted to really share this resource with you about trauma stewardship. The book is an everyday guide to caring for yourself while caring for others. And that's just a part of you taking a few steps back to practice that trauma stewardship, right? So I wanted to share that with you. How are we going? How are we doing? Are we good? Okay. All right. I'm gonna just talk about self-compassion domains really quickly, and then some really brief self-care strategies. So we have these domains here for practicing self-compassion. You can see we have the balance, we have physical, we have psychological, spiritual. So again, it's just making sure that we are aware, and maybe it may be taking a few minutes to just write it out and figure out what are those domains that you may need a little bit of support with. What are some of those new habits that you can create to increase that resiliency, that vicarious resilience and compassion satisfaction within yourself. Okay, because we know that positive mental health can prevent that work-related stress and burnout. So I really encourage y'all to continue to practice that self-care and that self-compassion. These are some just very quick self-care strategies that you can do as you create these safe spaces to practice self-care at work or when you're off work. Strategies under 5 minutes, strategies around 15 minutes, right? I know maybe some of y'all, thinking about that coffee right now, or music or aromatherapy. And then self-care strategies that you can do for more than 20 minutes, okay? And then lastly, I just want to encourage you to develop a plan and choose accountability partner to practice these self-care strategies to promote that compassion satisfaction and that vicarious resilience, okay? Thank you all so much for coming to my presentation. I really appreciate you all. I hope that there was a tool, a strategy, or something that you could learn or take with you.
Thank you so much, Nikki, for working with us at the time. So we're gonna switch up to our next presenter, who is healthcare for the homeless. So just give me a minute to do the switch. You already know.
Thank you all. Have a wonderful rest of your social work conference. Bye. Have a great weekend too.